It is a song, not just a mere song, but also that which is packed with welcome connotations. It is a song that entails reception, sense of ownership, and courage among community members and their desire to fight HIV and AIDS in their areas. It is a privilege to mention that this song signals that communities have welcomed the total control of the epidemic TCE project in their areas. They storm every household near and far in Mazabuka and Monzi districts like a team of firefighters putting off fire that has gutted the entire compound. They are clad in green t-shirts with orange berets on their heads. These are field officers working for the total control of the epidemic TCE project. Indeed, they are HIV and AIDS liberation fighters, armed to teeth with HIV and AIDS information, care, and support services. Development Aid from People to People, DAPP, runs the total control of the epidemic project in collaboration with the Ministry of Health and with funding from the Centers for Disease Control and Prevention. The field officers are the tools DAPP uses to reach out to people, to provide HIV and AIDS prevention, counseling and testing, ART and care services to the communities. The field officers have helped change perceptions about HIV and AIDS among communities and have helped tone down discrimination and stigma to and among people living with HIV. Through a door-to-door and one-on-one strategy, the field officers have reached out to over 280,000 individuals in Mazabuka and Monzi districts since the project started. The project started in Mazabuka in 2006. By 2011, a pilot phase had started in Monzi, and currently it is in full implementation in the district as activities in Mazabuka are phasing out after 5 years of its implementation there. As we watch this film, we will be learning from community members themselves, the passionates, also called the community volunteers, ART clients, the most at-risk people, field officers, and health personnel from the Ministry of Health, how the project activities are affecting people's lives.
Each field officer is covering a population of 2,000 people. Basically, the services that are offered by DAPP through these field officers, one, there is information giving. We go door to door, house to house. The field officer will give information. From there, when the client volunteers to be tested, the field officer is able to do the counseling and the testing. So when
it has not been easy in many cases for individuals to garner courage to go for HIV testing. However, with this door-to-door strategy, TCE field officers take HIV counseling and testing services right at the doorsteps of the communities. This has been possible through good relations between the field officers and the communities themselves. The field officers are trained and approved by the Zambia Counseling Council to provide counseling and fingerprint testing. The outcomes of HIV testing are twofold. It is either one is found HIV positive or HIV negative. For those that are HIV negative, the message is simple. They are encouraged to maintain their status by avoiding risky sexual behavior and by being faithful to their partners and by using condoms. And for those that are HIV positive, they undergo post-test counseling in order for them to accept their status and to take good care of themselves through positive living and through adherence to antiretroviral treatment, ART. There are cases of couples where one spouse is HIV positive and the other spouse is negative. Such kind of couples can still live together and support each other. It is not the end of their relationship or marriage. What is most important is to prevent the spouse who is HIV negative from being infected. This is done through the use of condoms. Men are encouraged to go for male circumcision to reduce the risk of infection by 60%, but still use condoms as a major preventive strategy.
Like in most cases, these couples, whenever one is negative and the other one is positive, there is always a problem. So I'm encouraging those couples, serious, I'm encouraging to say, whenever your spouse maybe is negative or positive, that's not the end. And don't just look forward for a divorce. Encourage her, don't lose hope. Otherwise, if you need necessary help, you must give so that she herself also cannot lose hope. This is my emphasis, whereby if one is negative and the other one is positive, that's not the end of the world. Encourage your partner. Never you think of divorce to say because this person is negative, this boy is A, B, C. No. The thing you must do is to encourage. You never know what is going to happen to you tomorrow. Maybe today you can be negative, the other day you'll be positive. What will happen? So, as like in my status, I'm here encouraging my friend to say, we must not lose hope. Most of the people come, you see when they hear about these things, if it was me, I could have done A, B, C, D, but in my case, that's not the answer.
Accessing ART in the 2 districts had been a challenge. Most rural health centers were not providing ART services, and clients would walk long distances to the district hospitals to access these essential services to prolong their lives.
Niza mtu ila tola 1 week kaendera hospital kata we safe senjari dota weze. Niza CD4 count where dota iweze to take after maybe after 3 months. Bali where dota iweze ino mwezi uji kambuka abantu balunga mbanji agula mpaka kwenda. Bauti waende. Taninga itabweze safe sako niza mtu wacha ninga mprocess watiani wahwa. Kamba utedenta jisimara utahamba na inka akakubweze service kuya ajanike kubusana kuyo, and sometimes abantu bakali kona ku hospital kutanda utiniza mujindi ahambane kuti bamuchita attend.
To save the situation, the project is taking ART services close to the people by establishing mobile ART centers in rural health centers. Presently, 12 mobile ART centers have been established in the 2 districts. A combined team of a pharmacist, the field officer, a clinical officer, and a nurse, including TCE volunteers called Passionates, work together in providing ART services as well as other counseling services to new as well as old ART clients at each mobile ART center.
It used to take them 3 to 4 days. The first day, they would walk to Chivuna. It takes them a day going there. By the time they reach there, you find them maybe also there is a queue. They are not finished in a day, so they have to spend a night there. The following day maybe is when they are going to be attended to. Then the 3rd or 4th day, that's when they will start coming back home. So it was so hectic to them.
The project is run with full support from the Ministry of Health through the district health management teams and the district AIDS task forces, DAPPs, including other stakeholders in the 2 districts.
Having TCE as a stakeholder in the district has actually increased impact. Impact in that we've had a lot of gaps in terms of service delivery in the district. First of all, I'd like to also say that prevalence has been high. HIV prevalence has been high in the district because we've had gaps where prevention campaigns are concerned. So with the coming of TCE, which were of course piloting until September 2011 and have now come in full force, it's been increased in impact by way of they've actually taken up Monza East, where they're doing door-to-door counseling and testing. So there's been an increase in VCT uptake services in the district.
The project also works with passionates who assist in transmitting messages on prevention of HIV and AIDS and other sexually transmitted infections, STIs. The passionates are also involved in condom distribution. In the first half of 2012, a total of 787,229 condoms were distributed. The passionates also take part in providing other support and care activities to those infected by the epidemic through fighting stigma and discrimination and by ensuring that ART clients adhere to treatment. Providing counseling, testing, and ART services alone are not enough. With this in mind, the project further supports target beneficiaries with grants to engage in income-generating activities in order to earn an income and to support themselves and their families. The project supports the formation of support groups, and through these groups, target beneficiaries are provided with grants of goats and seed packages.
Bagatukura how to jale support group. So to support group uno kujibera Yesu ite kwa yandaula support group. Tokabereka ambabo badapu gabatugurwa iha. Then kukaibinda 1 year. Katubereka ambabo. Then mujorwe bagaikutu funding amali. So almost 999,000. Project njitwa kujita tube mpongo. So twaibula mpongo 9 then yakaiwirana hamwe ibona kale.
Indeed, the TCE project is a beacon light of hope in as far as fighting HIV and AIDS is concerned, and the field officers are at the center stage in ensuring that the door-to-door strategy for fighting HIV is successful. The communities are high in spirit, eager and willing to work with the TCE field officers to combat this devastating epidemic.